Thanks for coming together this afternoon. As you know, we have said from the beginning of this school year that we believe it was important to offer in-person educational options for our students for as long as we can responsibly do it. That offering that in-person option for our kids and for families was so important for so many reasons, to maintain that personal contact between students and teachers, to give students that social and emotional connection to their fellow students, to create that in-person learning environment that is most conducive to learning for many students. For all those reasons, we wanted to make sure that we offered an in-person educational opportunity from the start and maintained it for as long as we could. And we've also signaled for a number of weeks that we would likely be getting to a place where we would have to take a step back and shift to a hybrid model. Today we are announcing that as of November 16th, we will be shifting to a hybrid model for K through 9th, and that involves a shift for 10th through 12th to remote. 10th through 12th is currently in hybrid already. So starting November 16th, K through 9th will shift to hybrid. 10th through 12th will shift to remote. And we do that because the numbers clearly indicate a significant and continuing rise in coronavirus transmission in our community. To put some context on that, if you look at the first few weeks of September, we were seeing less than 100 new cases identified per week. Over the last couple of weeks, we are in the neighborhood of 250 cases identified per week, with that number continuing to rise. We've also seen the positivity rate continue to be at an elevated level and continue to rise. And that's important because the number of cases per 100,000 can partly just be a function of how much testing you're doing. But if the percentage of cases that comes back positive continues to go up as well, it shows pretty clearly that there is a sustained increase in transmission throughout the community. As you all know, this increase in coronavirus cases and in transmission is happening statewide. It's happening in many communities around the state, but looking at our local numbers, the superintendent and her team, in consultation with Director Leonie Arroyo and her team, and all of us together at the city, have come to this decision, or the superintendent has come to the decision, and we support the decision, that this is the time when it is responsible to take a step back, to downshift to that hybrid model. I want to say a couple of other things, though. First of all, it's important to stress that at a time when many districts opted early on not to provide any in-person learning, the Hartford Public Schools worked hard to do that and to do it safely. And we still have not seen a significant amount of transmission inside our schools. I'm going to say that a little bit differently. We have not been able to confirm a significant amount of transmission inside our schools, and that's important. And that's a testament to the work that our team at Hartford Public Schools has done from day one to provide a safe learning environment in those schools. The second thing I want to stress is that we are not, for the vast majority of students, we are not shifting to fully remote. Again, through K through 9th, we are shifting from fully in-person as an option to hybrid as an option. And that means there will still be 2 days a week of in-person learning for those children and families who opted into in-person learning and will now be opted into the hybrid model. Because, again, we believe that providing as much connectivity, as much personal engagement, as much face-to-face learning as possible is good for the educational well-being as well as the social and emotional well-being of kids. I'm sure there'll be much for us to discuss and many questions, but without further ado, let me again thank the superintendent and her team for the thoughtfulness with which they've gone about this entire process, the care that they've taken to provide a safe learning environment, and I want to thank Director Leonie Arroyo and her team as well. Again, we've been working hand in hand in communication on a daily basis from the beginning because we all share the same goal, which is to do everything possible to give every educational opportunity to our kids, and at the same time to do everything we can to keep our community safe. But again, in light of the numbers we're seeing now and the continued increase in transmission, we believe that it's the responsible time to take that step back and downshift starting November 16th. Superintendent, over to you.
Thank you, Mayor Bronin, for recapping and for the partnership, and thank you also, Director Arroyo. We are, it's time for us to make a pivot, and I do want to highlight a few other details that are very important. The mayor did reference our commitment to making sure that our students have access to in-person instruction to the extent possible. And there are certain groups of students that will see no change. So I will start with clarifying that we have about 250 students currently that attend specialized programs. Those are students that will remain fully in person, students with complex needs that will continue to come see us every single day, despite the shift in hybrid to a hybrid model. Also making sure that we connect with our families to inform our families that we're committed to making sure that the supports are available for students and for our families. And what that looks like, we are going to be offering evening and Saturday tutorial opportunities for our students across all grades. Again, this is a testament to the hard work, not only of my team, at the district office, but our teachers that are, despite the hard work that they're doing, they're still saying, I think I can be part of that and support students and families. And so wanted just to highlight the additional supports. Learning kits are also being distributed to all of our students, making sure that they have the additional supports and supplies that they need, given that it's about 7,000 students that we're going to get ready to have, to have a shift. I do want to also clarify that for those students in pre-K to 8, they are going to a hybrid model. The days that they are not going to be in school, our teams, our school leaders have worked diligently to make sure that we built in live teacher access for a portion of the instructional block. So essentially what that means is that on those days that students are learning at home, they will still have access to live teacher instruction for a portion of the instructional block. That is a significant testament to the hard work that our teachers and our administrators continue to do on behalf of our students. And I want to just, transparently speak about how challenging the decision was for all of us. We connect daily on the weekends, and I will say what I told the mayor and Director Arroyo this weekend, and that is that I don't think I will ever be able to reconcile the challenging decision that was made. Whether it is personally or professionally, knowing that there is a health pandemic, right, at play in the world of education, serving urban communities with high needs. We knew of the other pandemic before COVID. We knew of the opportunity challenges. We knew of the lack of access. We knew the inequities. And it's really hard for me to stand here and say that, it's the best thing. I am not a health expert, and I am not ignoring the health data. And I know what it means when our students cannot have access every single day to instruction, when they cannot have access in person to the resources and the needs that they have. And so I don't think I will ever be able to reconcile that. Certainly not in my head with the numbers, with the data, and definitely not in my heart. So I want to communicate to our families that we are deeply committed, we remain deeply committed to making sure that we support not only our students, but also our parents. And so please, to our parents, do reach out and participate in the virtual learning sessions that we are providing to make sure that you understand how it is that you can support our students, and we continue to work with our partners to offer additional supports to our families and our students. Director Arroyo.
Good afternoon, everyone. I just want to give a quick thank you to Hartford Public Schools and all the work that they've done. Unfortunately, we continue to see our cases rise, and we will exceed the number of cases that we had last week at this point in time. We've still a number of days left for reporting for cases for the week that just ended on Saturday on the 31st. We will likely be over 500 cases for the last 2-week period at this point in time with increasing test positivity. It's not easy to make a recommendation, as the superintendent has stated, about moving to hybrid learning. But I think at this point in time, we just don't know the impact of this increasing community transmission and what it could potentially mean for schools. However, I have committed to continue to look at the data and continue to work with the superintendent and with the rest of my team, that if we do see that children are more at risk outside of a school building, that we may consider making the recommendation to look at going back into the school building full time. We think it's important to be open to where the numbers lead us and where the data leaves us. We think it's important to follow the science. We will see as well and learn lessons from what Europe is doing right now. They are currently going back into lockdown and still leaving their schools open in some capacity. So that will also give us some indication of what this means for children and allow us to see what that could potentially mean here for us in the U.S. I think there's some things that obviously for a city like Hartford we have to keep in mind. We know that the Latino and African American community have been very hard hit by this pandemic, and that is the majority of our residents here. We know that at this point in time, what we're seeing is that Latinos are accounting for an ever-increasing part of our caseload for those that we have data on. We are seeing some increases in hospitalizations as well. And so following the guidance that we have from the state that's out there, again, guidance that has been updated to reflect what we know now, but there's no one that's had kids in school in the middle of the surge or with such high levels of community transmission that we can look to. So this is an opportunity to hopefully keep kids and teachers and staff safer. But if it starts looking like it's different and the numbers tell a different story, then we will reconvene and have another conversation about what we can do. But it's unfortunate that this is where we're at, but I think it's really important for our community to understand that we need you all. This is a partnership. We need everyone to do their part, and that includes, again, avoiding those family gatherings. We continue to see that. When we can pinpoint a place where there's spread, family gatherings does come up. It's not the overwhelming amount, but it is a big number. We're seeing that spread happening in families where someone attends an event, a small gathering, and they come home and they give it to the entire family. And that will continue to put children out of school. That will continue to impact children. So again, we're asking the community to do their part. I hope that we can stand here later and say, it's better for our kids to be in school, and that the data support that and we can make that recommendation. Thank you.
Thank you, Superintendent. Thanks, Director Arroyo. And I just want to echo a couple of points that both Superintendent and Director Arroyo made. One, to the last point that Director Arroyo made, please, to our community and to everybody out there, whether you live in Hartford or beyond Hartford, please don't let down your guard. This is a perfect example of what is at stake. It's the education of our kids as well as the health of a community. And the faster we can work together to contain this spread and to suppress this virus, the faster we can bring our kids fully back into the classroom. And we know how much that matters. So we ask you to keep doing those things that may be frustrating, you may be tired of them, you may be sick of it all, but we need you to stay vigilant. We need you to wear a mask. We need you to wash your hands. We need you to watch your distance from other people. And very importantly, we need you to avoid gathering together in groups of people. That's where the spread is happening. It's so important to avoid those group gatherings that are driving this transmission. And please, even if you don't care about your own health, for the sake of the kids in the Hartford Public Schools, for the sake of all of those families who've been directly affected by this virus, for the sake of our community as a whole, and for the sake of everybody who's lost a job through this pandemic, please think about others, be careful, take the precautions, continue to take this seriously. And then secondly, I think it's really important to say what both the superintendent and Director Arroyo said. Communities like Hartford and our community here in Hartford have been particularly hard hit, both by the pandemic itself and because we have so many young people in particular who were vulnerable already before this pandemic. And so we have, on the one hand, the deep feeling of responsibility to do everything we can to serve our kids, to give them the in-person educational opportunity, to take into consideration their social and emotional needs and well-being, and knowing how important that is in every community, but especially here. And at the same time, to recognize that in communities like Hartford, the pandemic has hit heavy. And that's for many reasons that we've discussed many times. We have a lot of frontline workers. We have a lot of multi-generational living. We have a lot of large apartment buildings. We have a lot of families for whom it's more difficult to maintain social distance, even if a family member has been positive. And so that challenge of striking that balance is a tough one. And it's one that we have all wrestled with for a long time, and we're going to continue to wrestle with. But our goal as a community is and has to be to get back as quickly as possible to a time when we can bring our kids fully back into school, and to do that we need everybody's help. Any questions?
Can you confirm 7,000 students?
Yeah, it was hard to hear. Did you also have a day like Monday, Tuesday, Wednesday, Thursday, Friday, what it's going to look like on weekends and nights, so people have an idea of what's coming, what days are like? Ballpark.
Yes, so students will be in groups, right? So we have a Monday, Tuesday, with Wednesday as a remote learning day, and then Thursday, Friday. Thursday, Friday will be for the other group, right? So we'll have cohorts, Monday, Tuesday cohort, and then Thursday, Friday will be the other cohort, yes. And that's pre-K to 9.
And the nights and weekends when you do that, that's pretty impressive.
The tutorial support is going to be in the morning, in the earlier hours on the weekends. But the evening hours are going to be available as well. Right now, the plan is to have it from Monday through Thursday in the evenings, given that that's feedback that we have heard from our families, that even some families cannot support their children during the remote learning, and others, even though they're home, they still need additional support. And so we want to make sure that we're supporting families the best way that we can.
So no in-person or virtual learning on Wednesdays?
Correct. Now, for the students that are in specialized programs, we have about 250. Did you say in person?
You said no in-person or virtual.
Remote learning, yes.
Oh, on Wednesday?
On Wednesday, for everyone, yes. For the students that are in specialized programs, there's not going to be a change, so they're coming every single day. They're going to continue to access their individualized programming every single day. We are shift, by the way, in case there's a wondering as to why the shift now. Yes, it is driven by the external health conditions, but when we look at where we are in terms of a school calendar, we are nearing the shift to a new quarter. And so from an instructional and a pacing perspective, it is a good time now to also make the shift. We want to make sure that not only our families have adequate time to plan, but also our staff for them to have additional and adequate time to be ready.
In terms of, obviously metrics stuff is shifting a lot, and then again, in terms of where we would have to be in order to get back to school, is there a sense of where you have to drop down to, or infection rates, or any markers you guys are looking at?
So the 14-day average now has shifted from, is it 10 to, I don't know if you can speak
I mean, I guess what I would say, and Director Royal, feel free to jump in. I guess what I would say is we've said from the beginning of this that we're not looking at one number alone. We're looking at many different factors. So that includes the number of cases per 100,000, and the city of Hartford is now above 25 cases per 100,000, which is sort of the high end of the threshold that the state has put out. But regardless of the state's guidance on that, we're also looking at other measures. Again, we said we'd also look at the positivity rate. If we had seen the number of cases going up, but the positivity rate going down, that would have suggested that the number of cases we're seeing is mostly because we're doing more testing. But that's not what we're seeing. We're seeing positivity rates go up. And then we're also looking at what's happening regionally. And even though the region's numbers are below where we are, they're rising as well. And we're in a region where towns are pretty tightly tied together. So those trends all move together. But the other thing that we said we would look at from the start was in-school transmissions. And, although, and I think this is what made this decision so difficult for all of us, is that there still have not been all that many confirmed cases of in-school transmission. We have had a few more recently. We've just had 3 more probable cases of in-school transmission recently. But if you consider how many students are in, it's a relatively low number of confirmed cases of or probable cases of in-school transmission. That said, we also know that there's a lot of asymptomatic carrying of the virus among younger individuals, and so there may well be undetected spread that we're not finding. And the other thing, just more generally, we've all looked not just at our own data, but at other cities, other countries, and the truth is there is just no clear data, no clear compelling case right now one way or the other about the role that schools play in driving transmission. Again, in part, I think because of the possibility of asymptomatic spread. And so what we're trying to do at this point is take a measure that we hope will have an impact on the overall rate of transmission in our community and help keep our community safe and healthy, but also allow us to get this current spike in transmission under control. As Liani said, and this is important, if what we find is the opposite, we're going to change course. If we find that the number of cases among young people actually goes up when kids are out of school, then that's going to be a really powerful data point that we look at to say, clearly, shifting to hybrid did make things better, and we're going to adjust course. I think we have to have the humility here to say we're acting with imperfect information, and when we get better information, we may have to look back and say we were wrong and change course. We have to be flexible. We have to be constantly driven by the information and the data. And again, we have to have that humility to be able to say, we're trying our best with imperfect information, but where we get it wrong, we're going to acknowledge that and change.
You know where Hartford's numbers are at, positivity rate wise?
Yeah, I mean, for the last, our 14-day average right now is, I believe, 4.3. But if you, excuse me, that's not, it's 4.9 is our 14-day average. But if you exclude some of the big institutional numbers, so if you exclude, for example, Trinity and Hartford Correctional Center, our positivity rate actually goes up to just above 6%. Because those are places where there's a large number of tests being administered that skews the number a little bit. Interestingly, we saw a couple weeks ago that the number of positives out of Trinity and Hartford Correctional Center was driving up the number of cases per 100,000. And so it skewed our numbers upward. On the other hand, if you factor in the number of cases that they're administering, it's actually right now skewing the number of the positivity rate downward. So excluding those institutional testers, we've got a positivity rate of 6.3% over the last 14 days, and a positivity rate, a 14-day positivity rate of again, I think I said this, but 27. The question was whether school testing locations will continue to be available. The answer is yes. I mean, we're going to continue to get the mobile testing sites out there and available at our school locations. Again, anytime we talk about testing, I want to stress for people that in addition to the mobile testing, there's also a dozen testing sites available throughout the city on any given day. Our two big hospitals, our CVS pharmacies, our federally qualified health centers. So even if there's not a convenient mobile testing site near you on a particular day, there's guaranteed to be another testing site not too far from you on every day, every single day.
And is there a number of confirmed COVID cases inside Hartford Public Schools?
Say that again.
Is there a confirmed number of COVID cases inside?
Confirmed number of.
So we have had 59 student confirmed cases. This is 8 weeks of school, 38 weeks of school, 59 students, 34 staff, and 5 community members. And community members is community providers that are in our schools, and also transportation bus drivers or bus monitors. So a total of 98 over the last 8 weeks.
And that's out of how many students total?
So we have about 17,500 students.
Wow.
So it's less than 1% positivity rate.
All right. And also phase 2, are you guys looking at rolling back to phase 2 at all? Going back to phase 2?
City.
So the question was, are we planning to or looking at rolling back to phase 2? As you know, we are one of the red alert communities, and we have the authority to shift back to phase 2. But what I would say is this. I said a couple of days ago that we believe that is most effectively done at a statewide or regional level. We have been in close coordination and close communication with the governor's office. I believe there may be some announcements coming imminently on that subject, and would encourage you to listen to the governor's press conference at 4 o'clock. But what I will add is that our priority has been doing everything possible to keep schools in, and even though we're now going to be hybrid rather than fully in person, that's still a form of in-person learning, and we want to make sure that's possible. And so I strongly support measures that will help keep that possibility going, and that includes the type of restrictions that would be included in phase 2. Any other questions?